Welcome to Dr Joe Unplugged. This podcast contains general information and is not in any way medical advice. Some words are important but just sound awful. The term de-prescribe is just a most awful word. It really is. But it is important because essentially it's saying, how do we stop people taking or reduce the amount of medication that people are taking? We're all familiar with the concept of prescribing. People go to the doctors, you get put on a tablet, and increasingly in the 21st century, it's not just a course, but it may be and often is long term, and this includes, medications for cholesterol, might include medications for heart disease, diabetes, high blood pressure. The list is a fairly long one. And there are a lot of clinical guidelines advising doctors on how to prescribe. And a lot of the committees that set these guidelines, unfortunately, have links or financial ties to the pharmaceutical industry. It's estimated that in the United States, 83%, that's 5/6 of panels that made guidelines that were approved and implemented had financial ties to pharmaceutical companies. Now, this is really not acceptable in my opinion, but it doesn't look like anybody's asking my opinion. Not surprisingly, there's not much by way of guidelines on how to reduce and or stop medications. Now, I can immediately hear some of you saying, well, surely that's just a matter of stopping taking it. You just don't take it tomorrow. And look, in some instances, and I really want to emphasise that for anybody who's on medications, this is not medical advice, and if you're looking to stop whatever you're on, don't without chatting with your doctor. But in some instances, and probably cholesterol medications would be an example of this, there's no need to wean off them as such. There's no withdrawal effects from them. You can just stop them if it's deemed you no longer need them. But again, that might be a matter of checking blood tests. For some people with diabetes, depending upon their levels, they are able to reduce their medications, but this absolutely needs to be done under medical guidance. Antidepressants, there is a point at which people don't need them, but there can be withdrawal effects and one needs to come off them fairly slowly. An international review of recommendations found only 29% of clinical guidelines mention de-prescribing, and less than 10% provide any guidance on exactly how medication dosages should be ceased or reduced. Now, it's probably not surprising this is the case because guess what? There is no money in reducing or stopping medications. If you don't need your script every 3 or 6 or 12 months, you might be going less to the doctor. You're probably going to be going less to the chemist. And clearly, if a lot of the people who are making these guidelines have financial links to the pharmaceutical industry, there's no value for the pharmaceutical industry in you taking less medication. So you can see that it is in nobody's financial interest to do this, and governments don't appear particularly interested, and that's not entirely a bad thing because I'm not sure that they should really be getting involved in some of these areas anyway. This should be worked out between the individual doctor and the individual patient. However, we are increasingly in health, and this is not just in Australia, this is around the world, sort of restricted, this is for the average, the independent doctor and patient, somewhat restricted in what can be done by these guidelines, which become more de facto rules rather than guidelines. It's not official, but it can tend to happen. And a lot of doctors are quite wary of straying from the guidelines because of potential legal action. And obviously, you don't want to do the wrong thing. But it's not always the case that prescribing is the right thing. Stopping medication may be the right thing. And we've talked in another podcast about side effects and how at some instances the symptoms, like side effects can cause symptoms and they may be interpreted as a new condition rather than a side effect, and hence another tablet is added. Now, there's some instances where this is necessary. People with arthritis, particularly inflammatory forms of arthritis, may need to be on anti-inflammatory medications, and that might be necessary in the longer term. Now, these medications can cause reflux, acid reflux in the stomach, or ulcers. So those people may need to be on medication to offset that. Now, again, you could say it's not ideal, but that's the real world and that's what needs to happen. But there are a lot of other instances when rather than adding another tablet, maybe we should be reducing the tablet or stopping the tablet that the person is on. We also know that the guidelines, for example, for high blood pressure aren't necessarily that applicable as people get beyond 60. And there is a risk from low blood pressure, which is arguably greater than higher blood pressure, because if your pressure drops too low, you can faint. If you faint, you can suffer injuries, including a fractured hip, and that creates potentially bigger problems than the pressure being a little bit too high. But again, there's no guidance or information about that because it's not in anybody's financial interest. Australian researchers from Monash University led this study, and this one about the guidelines was published in the British Medical Journal Quality and Safety, found insufficient deprescribing recommendations were a universal trend, with the review's findings highlighting a glaring omission in clinical practice guidelines internationally. So this is a worldwide problem or issue. Again, they're going to recommend, and I would agree with this fully, that some type of indication is included. But before we get to those, and I'm not sure they're going to appear anytime soon because I don't see who's going to throw any money at them. So if money isn't thrown at them, then they're probably not going to occur. But ultimately, the first question, when you go to your doctor for renewal of prescription, rather than perhaps say, look, I've just come in to renew my script, maybe the question is, do I need to renew my script? And the answer may well be yes. It may well be yes, in which case, good, continue. But the answer might be no. It might be, well, hang on, you've been on this for a while, particularly with antidepressants. Do you still need it? Has the problem resolved? Are you feeling better? Maybe we should look at your bloods. How are your sugars going? Let's check your blood pressure. Maybe it's come down. Maybe we can reduce your dose. Now, it's going to be different for each individual person and circumstance. But, maybe the shining light in all of this is maybe we don't need deprescribing guidelines. Maybe we need to go back to basic principles and ask the simple question, is the reason that this medication was prescribed, is that still valid? It's a very simple question. There's two possible answers, yes or no. And then you can take it further than that and say, well, look, is the dose correct? If people are on more than one medication, do we need all of them? But, perhaps if we move away from looking to the powers that be and the concepts of guidelines, we can't do anything unless somebody in officialdom has said this is the way to do it, we can get back to that basic principle of is what we are treating or medicating still requiring treatment and or medication? And it's a very, very simple question to ask. And once you've asked that question, it opens up the discussion. Again, not in any way looking to presuppose or presuppose the answer. But if we don't ask the question, we're never actually going to think about it, and that doesn't then open the possibility to say, well, look, maybe you don't need this medication, and then we need to look at how it can be reduced. So given that nobody typically starts their life on a whole host of medications, when we're born, we're not on medications. I know you're going to say there's a couple of exceptions, that if there are some babies who are born who have the presence of drugs in their system for maternal reasons, it's a completely different issue, but just to clarify that. So therefore, anything that we've started, particularly in adulthood, is not where we started. If we take it back to, well, do we really need it? Is it necessary? Is it still doing what we want it to do? Is the primary issue still there? And or could it be managed in a different way? All right. Then we're not really talking about deprescribing. We're talking about just reverting to the initial status quo. Thanks for listening to Dr. Joe Unplugged. If you enjoyed this podcast, please subscribe, like, and share. You can also follow it on all the socials. There'll be new content uploaded each week.